Good afternoon. It's Friday, April the 16th. Segal, David Lahashu Jutz, and welcome to today's edition of the COVID-19 Task Force Update on this, our 203rd edition of Kahnawà 911. On today's show, we'll be hearing from Don Montour-Lazare of the KMHC in Public Health and the Commissioner of Public Safety, Lloyd Phillips. First up is Don. Don?
Now, Dave. Okay, so I'm coming here for a special update today because we had a new case of COVID today, and it affects KSS. It's involving one student, but we had to isolate the whole class that's with her and anybody that's been in contact with the student. Right now we have about 40 plus people that are in isolation related to this case and related to another outbreak that's related to a business in Kahnawà. So what this means for all the contacts. So right now what we've told the contacts is that they need to stay in isolation for 14 days from the day of their last contact. Then we also asked them all to come in to get tested today so that we can see whether or not they are positive right now. And regardless of whether the test is positive or negative, they need to stay in isolation for the next 14 days, and they will be retested again on day 12. What it also means is that anybody that's in their family that lives in their household, and we've had to deal with multiple households because some families, of course, like in this day and age, the parents are not together, so the kids are going back and forth. So we've had to isolate multiple households because of this. So they have to stay in isolation until they get the result of this test that they've done today. So by tomorrow, a lot of them will be free to go based on the results of the test. So we've also told the families as well too that the person that was in contact with this person needs to stay in isolation from the rest of the family, meaning that they have to be in a room separate from everybody else, and then ideally using a separate bathroom from the rest of the family. And if they can't, if they come out of the room, they should be letting people know that they're coming out and put a mask on and go to the washroom and make sure they clean the washroom after they're done being fed in their room and everything like we know would for anybody else. So I know when I was calling a lot of these cases, a lot of them were asking because some people had already been vaccinated and that should be affecting their isolation. But unfortunately right now with the amount of people that are vaccinated in the province, the guidelines for isolation still have not changed or actually have gotten a little bit more strict because of the variants. And the variants are worrisome because they're not the same as the original COVID that was circulating. It's changed, and we all heard it on the news where they're talking about the UK, the Brazilian, and the South African strains, and they all bring around their own characteristics to the virus, meaning that they could be more contagious, more virulent, meaning that it affects people more and more likely to cause hospitalizations and severe illness or even death. So even though we've been vaccinated, it does protect us against the original strain. It does protect us, the vaccines that we have right now, the Pfizer and the Moderna, protect us against the UK variant, but we don't know about the protection with regards to the other variants that are coming, and there may be more variants that may be coming along as well. So that's why we tell people we have to continue masking and keeping distance. That also being said is that we're being much more strict with regards to masking and that because of these variants. So it means that when you're in school or at work that you need to keep your mask on as much as possible, and you should be using a medical mask, not a reusable mask at this point. This directive's been like this for a few weeks now. So we're really encouraging people to use some kind of medical mask. So you would be looking for something that says on there it's a medical mask or that has been approved by the BNQ. So with the variants as well too, distance is a very important factor. I mean, we've always talked about the 3 pillars about hand washing, masking, but distance right now is a huge factor, and it also includes, where the spaces that you are. So you need to be at least 6 feet apart, even though you're wearing a mask. And you have to look at where you're at. So are you in a closed environment, like a car, or in a small room, or in a classroom? There might be some distancing going on, but we know kids, circulate within the classroom and that, and it's about 15, we're talking about 15 minutes cumulative over the day. So it impacts on the closeness of the contacts. Now that being said, with the contacts, we made an effort today to contact everybody that we know about that's been in contact with the case. So everybody that's been exposed, we've contacted everyone. So if anybody's worried about anything right now, we have no other further information. Everybody that was supposed to be contacted today has been contacted. So I'm trying to see what else I have to cover here. All right, so we're going to really, it's very important at this point now, like I say, to abide by the safety precautions that we should be taking with the masking, the distance, and the hand washing, even more so now because of the variants. We're lucky in Kahnawà that we have, about 74% of our population vaccinated and increasing over the next couple of days while we're vaccinating the teens. But we have to remember that the majority of Quebec right now is only at about 25%. So meaning, and you hear it on the news that most of the hospitalizations are happening in the younger population, and that's because most of the younger population haven't been vaccinated yet because they haven't been given the opportunity. It does take about 2 to 3 weeks before you start having some good coverage as well too, so that's an important thing to remember. But just being vaccinated doesn't necessarily take away 100% of the risk. We know that it's not 100% effective. We also know that based on your immune system, you may not get as good an immune response as some other people, so meaning that the vaccine may not be as effective for you. So they're saying 95%, but that's in most well people, people who don't have an immune system issue or are not over the age of 70. The older we get, the less our immune system is effective at protecting ourselves, and we don't get the same response to vaccines as we get older. So that being said, I said it's important to wear a mask, keep our distance, be cognizant, be really aware of where your environment is, where you're at, going shopping, and we really should be trying to limit our shopping trips. Think back to at the beginning of COVID and go back to the practices you had back then. Avoid going to the stores. If you notice that the store is too busy, pick your time to go when it's less busy. We want to try and make sure that we're not exposing ourselves unnecessarily. We have had people who have been in contact with cases who have had this variant. So we're not immune, we're being exposed to it, and we don't even know it. So it's important that we take all the precautions we can. The other thing is that we said this at the very beginning, and we're going to reiterate it again because, as we know, the numbers are going up, and we're up to like 1,600 today. It's putting a huge strain on the hospital and the ICUs, and the more strain we put on the system with COVID, the more likely that somebody having a heart attack or somebody having a diabetic crisis or having allergic reaction will not get the care that they need to get because they'll get to the hospital and they could get turned away because it's too full, or they won't be able to get the care that they normally would get because the system is overburdened. So you have to think about how we can protect ourselves, regardless of COVID, how we can make sure that we can get the care we need when we need it, and that's by making sure that we don't overload the system. So we need to think about that. If we want to look at it from our own perspective, that's the way we look at it, but if we want to look at it from a community perspective, and I think as Kahnawake, we usually try to think that, but we have to think about the greater community. Yes, Kahnawake, definitely, but the greater community meaning the outside hospitals as well too, because that's where we get our services from, and it's important that we don't overburden the system. We have to realize too that we're now like 14 months into this, and the healthcare workers are tired and they're getting burnt out. And so there's a lot of reduction in staff in a lot of places, and then it's not because they're sick with COVID, but because they're burnt out. And so the more strain we put on the system, the more we're likely we're going to continue burning out our healthcare workers. And so For now, I'd like to end on the, we need to keep on doing what we need to do right now, so we can keep the cases down, so that we can have a beautiful summer and be able to share it with our families. But for now, in order to protect our families, we need to do everything we can to be safe. All right, now I'll go.
Thank you very much, Don. Just a minor note before we continue. The Quebec Click Santé website is down, so those of you who are trying to book vaccines, please just be patient. If we have any more information, we'll get it right back to you as soon as it's available. Up next with another update is Lloyd Phillips. Lloyd?
Thank you very much, Don. I appreciate the wealth of information that you shared with the community, and obviously your ongoing work, obviously, leading the public health team in Kahnawà, as well as, doing a tremendous amount of work for the vaccination center. So certainly appreciate that, and I'm sure the community does appreciate the hard work that you put in there. I just want to cover a few points and emphasize a few points that you did make regarding what's happening, and there is a positive case at Kahnawà Survival School, and that's not that new cases were not expected, but because of the location and the way it branches out into the community, we felt it was important to relay information as quickly as possible to the community. And as Don mentioned, the contact tracing has been done, and those people who were identified as contacts were already spoken to by Don or somebody else from public health. And so if you were not contacted, that is a good thing. Because at this point in time you were not identified as a contact, so you could, I guess, rest assured, because I know we have several inquiries throughout day to day, people asking if they should be concerned, but that's the role of public health, is to ensure that they do the proper contact tracing and ensure anybody who needs to be isolated and or tested has been contacted. So they're on the job all afternoon making sure that that has been done. And again, a lot of the information is kind of new in terms of the new way of isolating, largely because of the variants. And we've been speaking fairly often about variants because it is a real concern. And it is somewhat of, plain and simple, it's kind of a downer, right? It is a downer because going back the beginning of March, when we started rolling out the campaign in the community for vaccinations, there was very little talk about variants, but throughout the month of March, primarily the UK variant has become more and more dominant, within the province of Quebec and everything surrounding us, and now is wreaking havoc in many areas of the province. And also, if you watch the news, Ontario is having exponential growth of COVID-19, and there's even talk of closing the border between Quebec and Ontario for a period of time, because it's basically out of control in many places, including Ontario. So, as Don mentioned, there is a level of protection from there is great protection, first of all, from the normal strain of COVID-19. We know the efficacy rate is very high, in the 90% plus area. And there is a level of protection against the UK variant, which again, that part is positive news. But there are other variants that are circulating, within the province of Quebec. The Brazilian variant and the UK variant. The South African variant, to be specific. And there are still some unknowns there. Although at this point they are relatively minimal amount of cases of these other variants around. A month and a half ago or so, there was very little UK variant around as well. So we have to be careful. We have to be mindful of that. And as more scientific data comes out about the level of efficiency or immunity to these variants comes out, that allows us to make decisions moving forward on what measures need to be in place and or modified as we go, either to lessen the amount of measures, or unfortunately there may be times we have to temporarily increase stuff just to ensure that we're maintaining and keeping our community safe. In that sense, it is unfortunate, but it is a reality that we are facing as a community. We are faring very well compared to the outside, but we have to maintain the vigilance to make sure that we stay on that path. Again, what's happening outside the community in the province and in Ontario, especially, again, is very concerning, and we have to keep that high level of vigilance. We have to remain in a red level alert. Because again, it is part of our responsibility as a task force and as public health and KMHC. We have to be able to communicate to the community about the reality that we're facing. We're not trying to scare people or anything like that, but we certainly want to make sure people clearly understand the urgency of where we are and communicate that for people to remain vigilant, despite the fact that we do have a high level of vaccination in the community. Hopefully, that's going to modify and that's going to change as more scientific data comes out, and we'll be able to have different communications in the weeks to come. As Don also mentioned, we're still hopeful. We're still looking towards the summer. We all want to have a relaxing time. We all want to have the ability to do a level of travel and be with our families and such. So, by being vigilant, by getting our vaccinations, and waiting for more scientific data and being safe and keeping that distance, we're looking forward to the summer to being a much more enjoyable than the position that we are in now. Be fortunate, Kahnawà, despite everything that is happening and some of, I guess, the restrictions and some of the negativity that you may be hearing, we are doing much better, and we have much more freedoms than there is within the province of Quebec and the Greater Montreal area. So together, we will get through this. Together, let's stand strong, and we'll talk to you again soon. Onerahtókha.
Thank you very much, Lloyd. Appreciate the updates. Just again, one more note, Click Santé is down. That's the Quebec website in order for you to book your vaccine. We still have one more day for 16 and 17-year-olds here in the community. So please, I encourage you to continue trying if you haven't booked your vaccine as of yet. That's it for today's update from all of us here. We wish you a very good weekend. Stay safe. Onerahtókha.